Is actually very different in terms of how we were trained as a pediatrician versus how I'm currently being trained as an anesthesiology resident.
When you look at United States or UK or Canada, you see that medical training is so long.
So board eligibility comes after you have completed a residency.
Is it more like continuous medical education?
Absolutely. So it's CME.
So many exams, even after finishing med school.
I spent time in Costa Rica, mainly to learn Spanish.
I was wondering, having gone through such an intensive training, being well compensated, having such a good lifestyle, what made you think of Uganda as a place to visit? Welcome to our channel. Today we have with us Dr. Ali Hemyari. He is a certified doctor from United States. Doctor, could you tell us about yourself a little bit more?
Sure. So thank you for having me. So I, as you mentioned, have completed my medical school training in in the United States. So the University of Virginia is where I did my medical school. I then completed a residency in pediatrics, which I understand would be like a master's level here in Uganda. So that was done at the Virginia Commonwealth University. After that, I completed a fellowship in pediatric critical care. That would be in the Children's Hospital of Wisconsin, which is in a different state. Currently, I'm completing a residency in anesthesiology
Oh,
at the Medical College of Wisconsin. And then next year, I will be pursuing a fellowship, which is additional training after anesthesiology in pediatric anesthesiology. And that's going to be at Lurie Children's. They're affiliated with Northwestern University in Chicago, Illinois.
we just listening to all those qualifications and trainings, I feel very gracious that you're here, a very specialized person. But I'm just curious, why go back to do a residency in anesthesiology when you're already a fellow?
Yeah. So I'm actually not just a fellow. I'm board certified in pediatrics and pediatric critical care. So when I was completing my fellowship in pediatric critical care, one of the things that I found really important in caring for patients in the pediatric population had to do with kind of two separate things. One is technical knowledge in terms of sort of the technical skill that an anesthesiologist has when it comes to their care of patients, both in the perioperative setting as well as sort of in the as well as in the critical care setting. They because of the constant sort of repetitive nature of anesthesiology when it comes to applying the technical skills that you have, such as intubation, line placement, things like that. The more you kind of apply those skills, the better and more facile you will get. And so in pediatrics in the United States, especially when it comes to critically ill children, we have actually started to use sort of non-invasive measures very effectively in caring for those patients. So less and less patients are intubated, for example, when it comes to respiratory failure. And we're able to manage them using non-invasive devices like CPAP or continuous positive airway pressure devices. So kind of long story short, I wanted to have expertise when it came to airway management. So that's one part of it. The other part is that anesthesiologists have really strong knowledge in patient safety as well as in perioperative medicine. So, how do we take care of patients who are going into the operating room? How do we think about them after they come out of the operating room?
True.
And then, how do we think about pain as anesthesiologists? Is actually very different in terms of how we were trained uh, as a pediatrician versus how I'm currently being trained as an anesthesiology resident. And so I thought, working in the ICU with very, very sick children who, any parent who takes care of a sick child, the last thing they want for them is to be uncomfortable while they're sick. And so, having certain patients who were incredibly uncomfortable actually really deeply impacted me in terms of pursuing this path.
I get what you're saying, doctor. I was in my pediatrics rotation in undergrad,
Hmm.
and there was this patient we had in ICU. I think he had cerebral palsy or
Hmm.
something, but that last stage care and pain management was so crucial for the parents of the patient because they wanted to see their child in less pain as possible.
Right.
And I think what you're saying, the training for anesthesiology brings about that difference. And that's very great and fabulous that you're doing this training.
Yeah.
Um, I heard you mention both certified, and I said fellow. I think I'm here at a gap, knowledge gap.
Sure.
Could you clarify that for me, please?
Yeah. So in the United States, when you do your training, so like a master's level training, you have to complete examinations after. So for pediatrics, after you have been um, board eligible. So board eligibility comes after you have completed a residency.
Oh,
So you do 3 years of training in pediatrics. You accomplish certain milestones, and we can spend some time talking about that. But when the residency program that you have completed your training deems that you're ready to sit for an examination called the board exam, you are then considered board eligible. After that, you have to take an exam, which is offered once a year. Um, and this exam is offered by the American Board of Pediatrics. So the American Board of Pediatrics, along with other specialties, kind of create they have a sort of organization that manages board certification. And so what that means is that you have not only completed training, but you have passed
they're relevant exams.
their exam, which effectively says that you have passed the standard
This,
for all of those patients.
so it's like an exit exam, I would say,
Effectively, yeah.
effectively.
So yes, and then after taking the exam, you're considered board certified, but you have to maintain certification. So we have maintenance of certification exams and sort of like not just exams, but activities that we will do. So we continue to maintain
So
our knowledge
is it
base.
more like continuous medical education? We have that here in
Yeah,
Uganda.
absolutely. So it's CME. Um, we do sort of different. There are different parts of the maintenance of certification. So one part of it is quality improvement. So not just what have you learned, but how are you improving the care of your patients as you move forward. One of them is kind of continuing to learn. So CME credits, and then there's also a I can't remember if it's part 4, but there's a maintenance of certification examination questions. So you have to kind of either pass these exams or pass these like questions every quarter or so, or you sit for the board again every several years. Obviously, it's easier to just kind of maintain your certification as you continue through. So that's how we kind of make sure that we have quality physicians taking care of patients. By many hospitals that you would
Regulations,
work for would ask for like a board
board
certification.
certification.
Yeah.
I get that. You know, hearing all this might be very daunting for some of these new aspirants who have just got into medical school.
Yeah.
Yeah, and there'll be like so many exams, even after finishing med school and all. So I was wondering, if we go back a bit to medical school, how is medical school in the United States? I don't know. I haven't been there myself,
Yeah.
but I hear that the training is good. And I know that you have come here to Uganda on a visit. So seeing the setting here and there, could you give some?
Sure. Yeah. So I think it's interesting the pathway towards getting into medical school in the United States is actually different than how it is in Uganda. So correct me if I'm wrong, but it sounds like in Uganda, after you finish sort of high school or what's called senior
Yes, senior six,
secondary
A levels,
A
equivalent to
levels.
that.
So that would be equivalent to finishing 12 years of high school in the United States. Um, Students then before they finish their high school, they will apply for furthering their education, not necessarily in medicine, but in any field, in a university or a college. So you effectively apply and get a bachelor's degree. Many applicants in medical school often will apply to or will kind of complete a bachelor's in science, what are called the hard sciences, like biology, chemistry, neurochemistry, neurobiology. But there's no requirement to doing that. So there are other students who may apply for like history or English or political science, things like that, things that they're interested in. And really, what the medical schools are looking for is a well-rounded individual.
Oh.
They do want to make sure that you have a strong knowledge base and the ability to learn the medical information as a medical student, but there's really no specific requirements.
Prerequisite.
Yeah.
Requisite, yeah.
You do have to take an exam, the MCAT,
To
which
get into medical school?
correct.
Okay.
So to get into medical school, there are requirements, and I've been out of medical school for like many years now. But when I applied, I took the MCAT, which is a standardized examination. My undergraduate degree or education was in engineering, so I was a bachelor's of science in electrical engineering. Um, and after taking the MCAT, you apply. Um, there's often essays that you have to write sort of about what interests you, and as part of the like process, when a medical school is interested in kind of having you be part of their school, then they'll send out invitations for interviewing, and that's when you get to know the candidate, or the candidate gets to know the school.
Uh-huh.
So undergrad is 4 years, and then medical school, which also I think differs, is 4 years. So correct me if I'm wrong, in Uganda it's 5 years
Yeah, 5 years, 2 years preclinical, and 3 years of clinical.
clinical.
Yeah.
So in the United States, it's 2 years of preclinical work, and so that's where you learn basically all the basic science you need. All the good stuff, genetics,
Yeah.
anatomy, physiology, all those things.
Biomedical sciences, if you could
Exactly.
put it together.
Yeah. And then after the first 2 years, you'll take your first of many exams. You've already taken exams at this point, but your next exam would be the USMLE, so the medical licensing examination, and that's broken up into 3 different sections. Step 1 would be the pre-clinical basic science base. There is some clinical knowledge that's also taught early in your clinical career. But the focus really is in basic sciences.
Understand.
And then after the first 2 years, you move on to the kind of clinical realm, and you'll spend time in different rotations, kind of learning the basics of medicine. So you might do a surgery rotation, an anesthesiology rotation, pediatrics, internal medicine, and so on and so forth. So that's really done in 2 years.
In 2 years.
The first year is really the foundational component of like what every medical student needs to know, and then your 4th year, or the second year of your clinical exposure, is kind of tailored to what's interesting to you, as well as getting you ready to apply for residency.
So wait, you mean that because here we don't have, I don't think we have an option of selecting the rotations we'll do in a year,
Oh yeah.
because here we have one rotation of elective where we can go to any hospital of our choice in any specialty and rotate there to get exposure to help us decide what we want in the future. But seems like you're telling me in US you have a whole list of options.
Yeah, absolutely. So again, it's been like more than 10 years. It's been about 10 years since I went to or since I graduated. But so one of the electives that I took was a month-long global health rotation. I spent time in Costa Rica, mainly to learn Spanish, so that I could communicate with patients in the United States who speak Spanish, and really kind of develop that therapeutic relationship. Another rotation that I took was pediatric radiology. I knew at that time that I was interested in pediatrics, and so I was trying to expose myself to all the variable sides of pediatrics. So pediatric radiology, I did a pediatric surgery elective. I did. We'll do what's called an acting internship, where you spend a month kind of acting like a first year physician, where you'll kind of make the plan, discuss the patients with the attending physician, and then kind of execute that plan and follow up with the patient. Those are really important to kind of introduce yourself to the medical system, and sort of like, for example, if you do your acting internship in one certain hospital, then that the people who work at that hospital get to know you, and can have a better sense of how you would be as a physician.
We always had this issue in the eastern side of this world in terms of medicine, is that when you look at United States or UK or Canada, you see that medical training is so long. You're always wondering, why is it like 4 years of pre-med or undergrad, and then 4 years of graduate school where you're doing MD as medicine, and
Yeah.
you're qualifying as someone equivalent to someone who has just done 5 years here. But since now you have given us that brief, I feel like it's the same, because here after 5 years we have to go for an additional of 1 year of internship to apply for a license. And I
Yeah.
think there, since you're having internship as part of your 4 year program,
So that's not true, and maybe I need to clarify. So your internship is actually the first year of your
residency.
residency.
Oh, okay.
But you're acting as one, so you're still a medical student. You don't have a license to. You're not an MD.
Okay.
But there's always a resident or a doctor who is providing those orders. But as part of your learning, you're sort of learning how to be an intern.
An intern, yeah.
There's, as you may know, I mean, as you may have experienced, and I definitely experienced, there's always a big learning curve when you're transitioning
Yes,
from different,
from undergraduate
stages.
to intern, and then from
Absolutely.
intern to it's a big change.
Yeah. And so, one of the ways that we try to kind of bridge that gap is allowing these sort of transitory
Periods.
periods. Yeah. So, like, this acting internship really kind of plays that role. Yeah. So that's what we do. But an intern, we definitely have an intern. So after your third year of medical school, then you'll take an exam called Step 2, which really
For USMLE, yeah.
exactly, the USMLE. So that tests your clinical knowledge.
Clinical knowledge.
And then once you've graduated from medical school, you'll take the third step, or step 3 of USMLE.
Which is more like an OSCE, I think.
Not just an OSCE, there's also a clinical knowledge, component, but it's definitely more geared to someone who's completed, a year of internship.
Okay.
And you'll take that sort of during your intern year,
Yeah.
right before you finish, or sort of halfway through finishing, you'll take this.
And I think the results from USMLE will determine what specialty you're located into the residency program, or
Yeah, so it's very
Because-
interesting. The United States system is actually in constant
change.
evolution.
Okay,
Yeah.
evolution.
So historically, that was the case, where often you may apply to like an internship separate to what you're interested in. But more and more, these programs are actually sort of combining. So you will apply for example, for anesthesiology, you will apply for both the categorical anesthesiology residency as well as your internship together. So now these residencies are like 4 years instead of what were 3, and your first year being your internship year. The expectation often is that if you've been accepted to a residency program, that you're going to have no trouble passing step 3. So I think for a lot of applicants who may be interested from overseas, often it's actually helpful to have taken step 3,
Step 3.
so that isn't even a question with regard to your ability to be a physician.
That's true.
So you can take step 3 whenever you'd like. Some people take it actually before they graduate, but there's no requirement to do so.
Among all these processes, it sounds like a long process.
Yeah.
Among this whole process, what I found the most amazing part of it was, to apply to undergraduate program, you don't need to have a specific subject requirement like you have in this part of the world, where biology is like a compulsory thing you need. like you said, someone can do history and then they jump into medicine from nowhere. And
Yeah,
I think you have done engineering. And
right.
so what?
Yeah, I think it's there are prerequisite classes that you have to take, but
Okay.
you don't have to be a master or complete a bachelor's in that subject matter. There are all requirements in terms of courses that you have to take, but those requirements don't um, necessitate that you have an undergraduate, like a bachelor's
Bachelor's.
in that. So, for example, for me, I did a undergraduate. I did a bachelor's of science in electrical engineering,
Wow.
and while, again, the education system there is to try to be a well-rounded person. So you will take other classes,
At that point.
and so as part of my just interest, general interest, I took some biology classes. I took organic chemistry, just to kind of like round out what I knew. And so when I was applying for medical school, which was in my initial interest, I only had to take one or two additional classes to kind of complete those prerequisites.
Prerequisites.
Yeah. So they'll ask you to have a certain amount of prerequisites completed, but you don't have to finish a whole like biology.
Before applying.
Absolutely.
That's true.
And so it's interesting because you'll have a lot of physicians in the United States whose undergrad degree is in like a completely different thing. A lot of anesthesiologists actually turn out to be engineers, which is kind of interesting to me.
Maybe
But that
that's
mentality seems
maybe I
to fit
think that
very
that's
well.
what is driving you towards anesthesiology.
Yeah, I think so. I've loved my experience as a resident and taking care of patients in the perioperative setting. So I wouldn't change it for anything else. I like taking care of children, and I like being an anesthesiologist, and so that's why I'm kind of gone down this path.
Oh,
So
yeah. So you told me that you're currently pursuing from the area of Wisconsin, right?
Wisconsin, yeah.
Wisconsin, sorry. Um, what made you decide to go in that direction? Is it lifestyle or is it income? What is it exactly?
In anesthesiology,
Because I know anesthesiology is offered in different places, obviously.
yeah,
But why specifically Wisconsin?
yeah, that's a great question. Okay, so to answer the anesthesiology piece, I kind of talked about why I wanted to do anesthesiology. Um, I did not know at the time that it would be a lifestyle improvement for sure.
Okay.
Anesthesiologists are one of the most well compensated physicians in the United States. And I think rightfully so. They do the work that they do is
So
critical.
critical, yeah.
Yeah, in taking care of patients safely. So why the Medical College of Wisconsin? So the Medical College of Wisconsin has a very strong history in anesthesiology. Some of the kind of key players when it came to research and an understanding of anesthesiology actually
Come from
come out
Wisconsin.
from the Wisconsin area. So it's interesting after like as you kind of go through your residency, you get to meet some of these attendings who you actually have no real understanding of who they actually are. And then as you get to know them better and better, you realize, oh, these people are like giants of the field of anesthesiology, and they have contributed significantly to that. And so the medical college has had that history for a long time. They also have an incredibly great pediatric anesthesiology department. So being in the Children's Hospital of Wisconsin, Children's Wisconsin, for my fellowship in pediatric critical care actually really exposed me to those anesthesiologists. So in the United States, pediatric intensivists or persons who do critical care sort of go down the pediatric pathway. So you can't be a board certified pediatric critical care intensivist unless you've completed a pediatrics residency. And so for those who are dual boarded in anesthesiology and pediatric critical care, they've actually kind of gone both paths. And so there are very few programs in the United States that actually do that. Johns Hopkins is one. Children's Hospital, the University of Pennsylvania is another. and then Medical College of Wisconsin is a third. There's like two or three other ones
That provide this dual residency
that provide
pathway.
this dual program,
Yeah.
dual pathway. And so that was very important to me, to work with, as I was finishing my fellowship or completing my fellowship, I met these dual specialized individuals who really brought a different perspective to the care of patients in the pediatric realm. And that's really kind of what pushed me in that direction. And then, so because I was there, and I knew the program, and I knew that how strong both their anesthesia department was and their pediatric anesthesia department was, that's why I just chose to go there.
Seeing your whole journey through your narration, I was wondering, having gone through such an intensive training, being well compensated, having such a good lifestyle, what made you think of Uganda as a place to visit
Yeah.
in the medical field, especially?
Yeah. So just to clarify, when you're a resident or when you're a trainee, your lifestyle isn't great.
Okay.
You do get paid as a resident, but sort of part of medical education is this idea that you sort of delay gratification,
Yeah.
right? So you spend a lot of your time learning, studying, taking exams, in the hope that in the future, or with the like encouragement, and then that in the future it will all be well worth it. So I think my perspective has changed over time, having had such a long journey, because mine is not the typical pathway. Most people, will finish a residency and then go on and work
No.
as an attending. But you sort of learn to love the journey, which has been what it's been like for me. So having loved the journey, what brought me to Uganda actually was so as part of my education in anesthesiology, there are certain opportunities that are available to residents, anesthesia residents, to actually pursue some education, kind of as a global health, in the kind of global health realm. So the anesthesiology specialty in sort of high income countries is quite robust.
Okay.
So the way that they kind of determine that is how many surgical physicians. So it's kind of like surgical, obstetric, and anesthesiology individuals are within like 100,000 patients.
Patients, yeah.
And so in high income countries, that number is often like 40 or higher.
Yeah.
But then in low income or middle income countries, that number is significantly lower. And in some countries, it's actually less than 5. So less than 5 individual surgeons,
For every
obstetricians, or
10,000 patients.
anesthesiologists per 100,000 patients.
100,000 patients.
Right.
That's very low.
That's incredibly
Yeah,
low,
that's-
yeah. And so when it comes to the care of patients who inevitably will need surgery, or will need a C-section, or will need some sort of medical care, those patients deserve good quality anesthesia. Anesthesiologists make sure that patients stay safe in the perioperative setting. And so we have a huge, critical role in making sure that patients survive. And so as part of that, I had the opportunity to kind of pick, coming to Uganda and working to help develop sort of non-physician anesthesiology providers. And so I've been fortunate enough to teach some of these students in the Kabale School of Medicine. So that's an ongoing project, and something that a lot of people are working on, not just me. But I have been fortunate enough to kind of be a part of that. Try to share some of my knowledge and some of the experiences that I've had, so that we can take care of patients. And that's really the key here. Is we just want patients across the globe to have good quality care. I think a lot of people who aren't familiar with medicine are scared of having surgery, and rightly so, because of the sort of inherent risk
Risk with that
with
comes with surgeries.
right, with surgeries and with anesthesia. And I think we have found, at least in the United States, that over time, because of the emphasis on safety, that most surgeries and most anesthetics are quite safe, and we can get patients through surgery safely, so that they can live their lives, better.
But
So hopefully we can kind of continue that
the goal
globally.
is to avoid complications as much as possible.
Right, exactly. Avoid complications. So, there's a couple of different things that we do. Preoperatively, like before a surgery, we'll assess patients. We'll try to see, are there things that we can optimize? Can we take care of patients when they're in their best state of health, or as good of a state of health as we can get them before they finish surgery? And then during the whole surgery itself, can we make sure that we keep them safe? And then post-operatively, how can we make sure that they recover safely?
That's great work, I would say. And I have been thinking of anesthesiology a bit, but I think this conversation has really brought it out clearly. Um, my one question would be, what competencies or what attitude or personality would you look for in students if you are trying to uh, bring them in for anesthesiology residency or pediatrics residency?
Yeah.
The reason why I'm asking is I don't want to go into a program that my nature doesn't, uh, I don't know, my nature is not in sync with.
Sure.
So I want to make sure that wherever I go for my residency program, or whoever is watching this and they're going for their residency program, they're well aware of what type of person they need to be to get through the program.
Yeah. Great question. I think, personally, this is a personal opinion of mine, I think anesthesiology as a whole has been poorly represented in the medical sort of realm, which is actually a big reason why I'm doing this interview, is because I think that many medical students and those who are interested in medicine don't really have a good sense of what it is to be an anesthesiologist. I think and I had the same misconception that you sort of sit behind the drapes, you watch the surgeon kind of take all the glory, and you sort of just don't really do much. You just kind of sit there. But the reality is that that's not true. We are experts in critical care. We take care of very sick patients. We resuscitate them. We keep them alive. And we do a lot of work in the background making sure that patients are staying safe. We also play a role in the management of their pain, making sure that they're safe, they're having their pain managed safely. And so all of that is a huge part of what I do. And then we kind of briefly touched on obstetrics, but I have to say some of the most gratifying patient encounters I've had as an anesthesiology resident have been taking care of pregnant mothers who that's an inherently painful process, and kind of making sure that they're
Especially for
safe.
through labor.
Exactly. And so we provide pain control for that. What kind of personality do you need to answer your question? I think above all, you need to be someone who's curious and someone who's kind of intellectually curious about sort of how do things work. My personal experience has been, I have a particular love of physiology and trying to understand how the body works. And so I think that plays really well for folks who are interested in sort of understanding physiology and sort of understanding how, the cardiovascular and respiratory system kind of work together. We spend a lot of time thinking about the nervous system and how best to alter it so that we can manage pain. But then you also need to be someone who is not uncomfortable being decisive. So in the perioperative setting, you often don't have a lot of time to make decisions. And you have to be comfortable sort of quickly identifying what the problem is and acting. And so this is a contrast to other specialties like internal medicine or pediatrics. While there may be individuals who are like that, those individuals I think who are in kind of the medicine, the medical realm versus the surgical realm, tend to like to sit and contemplate and build a differential.
Differentials. But I think in anesthesiology and especially intensive care, there's no time for that.
Yeah, you have limited
You have
time.
limited
So
time.
sometimes you may have a little bit more time, but often you have to make a decision quickly. And so I think feeling comfortable with that is there. I think often, so I liken an anesthesiologist to being Batman, right? You wear a mask, you're sort of in the shadows, like people don't really recognize who you are. Some people are scared of you, but you save lives, and then you don't really get thanked for it, right?
True.
And that sort of thankless nature of it is okay, because you know that what you've done is important and incredibly impactful. The ability to resuscitate a hemorrhaging patient and keep them alive through the duration of a surgery, I think there's nothing that kind of nothing that can beat that, where you know that you have been able to keep a patient alive while the surgical team does what's also important. Not to at all kind of diminish what their role is, but it's great to be part of that team, communicating with a surgeon and kind of taking care of a patient.
May I ask what challenges you faced through your anesthesiology residency? Because I know that you had done a residency before,
Yeah,
pediatrics. It
yeah,
might have helped you with the routine and all,
yeah,
but then still, once something is new, it's new, obviously.
absolutely. I think so. Fatigue management is always going to be a challenge for anyone. I was fortunate enough to learn a lot of how to manage that during my fellowship in critical care, because we spent a lot of time kind of being up at the bedside, awake. But I think that would be a particular challenge for a lot of people. We work hard. We spend a lot of our time in the operating room, but we also spend time outside of the operating room learning, reading on our own, and trying to kind of further out our own knowledge. I think one of the key skills that any physician, but in particular anesthesiologists, need to kind of focus on and develop is kind of interpersonal communication. I think that's a particular challenge for anesthesiologists, because we are working with other physicians as a team to take care of a patient. My strategy for that has always been to focus my efforts and sort of my main focus being on the patient. So kind of framing everything and anything towards the care of the patient and what's best for the patient. And then not really being afraid for advocating for those patients. Yeah, because again, our main role is to keep patients safe. And so if we feel that a certain thing that
may not help the patient,
right, that maybe you should probably kind of raise that as a concern. And I've done that as a anesthesiology resident with the support of my supervising attendings, to kind of make sure that we provide what's safest for the patient. I think those are the big challenges. There are obviously a lot of challenges, and everyone's challenge is going to be a little bit different, but I think that's probably the biggest one that I would kind of mention.
Thank you very much, Doctor, for your time. Any closing message for our audience?
No, not at all. I think one of the things I would say is that it sounds like in Uganda, you guys spend 5 weeks?
5 weeks in anesthesiology.
5 weeks in anesthesiology, which is
a great
amazing.
exposure.
Yeah.
We have seen all what the anesthesiologists do, all the charting and everything.
Yeah. And I think that's great. The more time you are able to spend in a specialty, the more likely you are to actually have a better understanding of it. We in the United States don't often have that opportunity. Where I went to medical school, we spent 2 weeks in anesthesiology, and that's why I didn't even consider anesthesiology as a specialty until much later. But I think that keep your mind open. Don't always rule things out before you have a better sense of it. And some of these specialties, like anesthesiology or like even pathology, you're sort of like hidden from the rest of the population.
Especially pathology.
Exactly.
You never hear about those.
You never hear about pathologists. Maybe you should have a pathologist on at some point.
Yeah.
But kind of keep your eye open. There are different physician specialties that might kind of suit your nature. And feel free to always ask. I think Being curious when you're a medical student is key
It's
to
key.
making sure that you
True.
make a decision that's
It's right in the
that's
long
right for
run.
you. Exactly. You know, you're going to spend an entire career doing something, so make sure that the choice you make is the right one,
Is the right
so that you can live a productive and happy life.
I think interviews like this, especially this interview with you, would really enlighten all our viewers
I hope so.
in anesthesiology,
Yeah,
and that would help them make the right choice.
for sure.
Yeah. Thank you very much, doctor.
You're welcome.
We hope that you come back soon to Uganda for your next trip of your teaching, and probably this time it's more into critical care, because we also need help with critical care in Uganda. And it was lovely to chat with you today.
Well, thank you. I appreciate the opportunity, and yeah, I wish you the best of luck and everyone here. I am looking forward to coming back in the future, hopefully.
Thank you very much.
Yeah, you're welcome.
If you enjoyed this video, please give it a thumbs up and share it with your friends. You can also subscribe to our channel for more great content. And don't forget to follow us on Instagram, Twitter, Facebook and TikTok.